वारियाह बेमारि छ यम कुदरती पाने ठीक छ गसान अमिक क्रेडिट छ गसान डॉक्टरस बाजे छ डॉक्टरस गलती गसान तमिक क्रेडिट छ मिलान पीरस फकीरस ज्योतिषियस या अमिस जड़ी बूटी वलिस
तवे छ वनान आजकल कशीर मंज के बुजुर्ग छ ज्यादा फिट जवानन हिंद खोत तिकाज तिमो छ पन्निस वक्तस मन सोरी के बड़ प्योर कंज्यूम कोरमुत आसान
तुतन प्योर कंज्यूम बे पकान पेवान गसुन मे पेवान गसुन कॉलेज या स्कूल पकान पकान तम 2-3 किलोमीटर 4 किलोमीटर आसान आज छुन लड़कस आसान स्कूटी सह नेरान सुबह गोडनेथी पन कोचिंग सेंटरन पे पत यिवान they have got a problem also. I think we have to change the system. Magar if you personal relationship shows bemaras this is lost. I think we have to use the modern technology to the best of our knowledge, best of our diagnosis, but at the same time maintain a human contact with the patient.
नाजरीन आदाब, आप देख रहे हैं जी के पॉडकास्ट और मैं हूं आपकी मेज़बान शीरीन नामान। कश्मीर की मिट्टी गवाह है यहाँ के अदबी अदीबों की, दानिश्वरों की और कुछ ऐसे लेजेंडरी इंटेलेक्चुअल्स की, कुछ ऐसे पर्सनालिटीज़ की जिन्होंने अपनी कामयाबी का परचम न सिर्फ वादी में बल्कि दीगर ममालिकों में भी काफ़ी ऊंचा लहराया है। इसी खोज में आज हमारे साथ जुड़े हैं एक मारूफ व मुअज़्ज़ज़ शख्सियत जो किसी तारुफ के मोहताज नहीं है, डॉक्टर जी क्यू अलाकबंद साहब। सर आपका खैर मकदम है हमारे शो में।
Thank you very much.
सर मेरा पहला सवाल आपसे ये रहेगा कि पुरानी यादों को अगर हम वापस थोड़ी देर याद करें, इफ़ यू टेक अस डाउन अ मेमोरी लेन, how has Dr. Allaqaband started with his medical journey? Tell us briefly something about your evolving years.
Uh, Thank you for having me. I never wanted to be a doctor. Uh, I was studying in school and was doing very well up to eighth. My school changed then from private to government school, and there was no science subjects teaching facility there. And in my matric, I failed science. I got third division, which was a shock for the whole family.
Okay.
So they told me now you'd better do some service. But God bless my uncle, he said, no, you go to college. So I went to college. I was willing to do my maths because a neighbor of ours was in engineering. He was a overseer, diploma in engineering, and it was a big thing those days. And I wanted to really emulate him and become a overseer. So I told them I want to take non-medical. They said, no, you have failed in science, you better take arts. This went on for a few days, and then a grand uncle of mine who was illiterate, who took me to Professor Want Saab, who was a professor of English. And he said, why you want to take non-medical and leave arts, write an essay
अच्छा,
and bring it to me after 1 week.
okay.
God only knows what I could write to Professor Want Saab, doyen of English. So I went with an essay. He didn't see it. He tore it and threw it from the window. He said, now you don't take non-medical, you take medical because I was in Emerson College. Now I have been transferred to SP College.
अच्छा,
So I'll be there to look after you. You take medical now. That is how I took the medical. And that is how, and after working hard, I did well, and in whole Jammu and Kashmir, there was only one first divisioner and
right.
six second divisioners, nothing
You have
else.
left an
And
indelible
for,
legacy.
pardon me, and then uh, I was one of the second divisioners, and I was selected. I went to Madras. And when I reached there, and they told me, no, you cannot be admitted because you are underweight. So I had to come back, take another year in the college as BSc, third year. The next year I was again sent to Madras, and that is how I started my medical career.
Okay. Sir, you have a very, I would say, a name with which has left an indelible legacy in the field of medical sciences. So please tell us something that during your tenure, what were some of the most important, significant contributions that were done and which have left an impact on all the people around?
Well, when I joined as an assistant professor, and I was fortunate to work with Professor Jan Saab, and for a couple of years, 3 years, then he resigned prematurely. And after I became a professor, I started my career there. I didn't do much, didn't contribute much apart from the academics.
अच्छा,
Then in 1980, I became an administrator of the hospitals. And I must say, I tried to do my bit a little. We started Children's Hospital. We started Laldet Hospital from 100 to 500 bedded hospital. We started separate bone and joint hospital with the collaboration of Dr. Ashai Saab.
yes,
And I had subjected a plan for a 700 bedded hospital near Ranavari, amalgamating Jawaharlal Nehru Hospital, Psychiatric Disease Hospital, and a new general hospital. And land was acquired, it was fenced, but unfortunately the government changed, and the governor's rule became one of the advisors allotted this land to the fire sufferers, and we lost that land,
अच्छा,
and we could not do much about psychiatric disease hospital at that time.
अच्छा. सर अगर एक पेशेंट और डॉक्टर की रिलेशनशिप को देखा जाए तो तुंदिस वक्तस मंज वारिया हमदर्दी पानवन यम जन पेशेंट्स डॉक्टरन हुन ट्रीटमेंट रवैये तिमन सहित ओस काफी डिफरेंट देन व्हाट इट इज टुडे सो हाउ डू यू फाइंड दैट पेशेंट डॉक्टर रिलेशनशिप देन एंड नाउ
यह छु अख सु रिश्ता अखन युस बेमारस तो डॉक्टरस कायम सपदान गोड़ गोड़ छु आसान ये सिर्फ प्रोफेशनल मगर यम साथ वारिया बड़ान छु यह छु पत एडवाइजर बनान पत छी बेमार यवान पत छु दपान मे हज ओस फलन जाय लड़कस या लड़की रिश्ते यवान तोह मा छ खबर तिहंज कह या ओसुस वनान मे हज ओस बह कर यह काम तो यह हेका बह करिथ तो मे छु फलन जाय कोरहस बह ट्रांसफर सो जाय छा माने खत यह एडवाइजर बनान यह तम सातन तुथ आई कंटैक्ट आसान बेमारस पृछान तमिस हिस्ट्री तुलान तमिस एग्जामिनेशन करान बेमारस तसली गसान आजकल डिजिटल एज यह सोरे वन कंप्यूटर्स पे मच बेटर नो डाउट अबाउट इट मगर
आर्टिफिशियल
यह
इंटेलिजेंस
आई कंटैक्ट यह आई कंटैक्ट यह कहें सह दपान बेमार यह सिर्फ पन्निस फोनस पे या कंप्यूटरस पे मोन बोजान कहें यह सोरे बोजान अम रिकॉर्ड तक मगर बेमारस तसली गसान कहें वारे फिर वतवान मे वुक ब्लड प्रेशर तिकाज ब्लड प्रेशर वुचमुत नर्स नब्र कनत या अटेंडेंटन नब्र कनत तम सुंद पल्स गुजर यह दपान डॉक्टर ना वुचन मे कहें यह तिमन तसली गसान कहें इस आई कंटैक्ट यह बड़ जरूरी फेस टू फेस अमिस गसान तसली बेमारस यह वुचान मे यह बोजान मे तो बाजे बेमार सं तसली गसान अमि सतन डॉक्टर जेस्चर बनावान यह वुचान अम क्या कोर अमिस आवा खुशी यथ फेसस पे अमिस आया बुथिस पे खुशी या अमिस गोवा परेशान यह गोवा मान सतन तंग यह बेमारस पे अमुक असर पेवान
सर मेडिकल यूज टूरिज्म एक शोबे द मेडिकल फील्ड डायनामिक्स इफ वी टॉक अबाउट तो उस टाइम पर कौन सी ऐसी आई वुड से प्रैक्टिसेस थी हाउ इवॉल्व्ड डू यू फाइंड दिस मेडिकल फील्ड देन एंड नाउ आई वुड से अगेन
वो वन तम सातन सिर्फ डिपेंड करान सिर्फ हिस्ट्री एग्जामिनेशन बेस कम क्या इन्वेस्टिगेशंस अवेलेबल आसान अत सोरे करित डायग्नोसिस करान تہٕ واریاہ بٮ۪مارِ چھِ یِم قۄدرٔتی پانَے ٹھیٖک چھِ گژھان اَمیُک کرٛیڈِٹ چھُ گژھان ڈاکٹرَس بعضے چھِ ڈاکٹرَس غلطی گژھان تَمیُک کرٛیڈِٹ چھُ میلان پیٖرَس فقیٖرَس جوتشِیَس
हाँ
یا أمِس جڈی بوٗٹی وٲلِس
बिल्कुल
یہِ چھُنہٕ مگر یُس وٕنکیٚنُک وقت چھُ وٕنکیٚنَس چھُ واریاہ اِنوٮ۪سٹِگیشَنٕز وٕنکیٚنَس چھِ ڈایگناسٹِک فیسَلٹیٖز بیٹَر اَسہِ کَرِمَژ چھِ واریاہ غلطی مےٚ تہِ آسان واریاہ غلطی کٔرمٕتۍ مےٚ تہِ آسان واریاہ لٔڑکہٕ فیل کٔرمٕتۍ تِکیٛازِ تِمو ووٚن نہٕ تہِ یہِ میون کَنسٮ۪پٹ اوس مگر وٕنکیٚنَس چھُنہٕ تہِ وٕنکیٚنَس ہیٚکہِ کینڈِڈیٹ اَمی ساتہٕ ؤنِتھ ایٚگزامنَس نہ سا ژٕ چھُکھ غلط یہِ چھُ یِتھ کٔنٮ۪تھ یہِ چھُ ڈِجِٹَل چھِ واریاہ فرق مگر یُس یہِ پٔرسٕنَل رِلیشَنشِپ چھُ بٮ۪مارَس سۭتۍ یہِ دِس اِز لاسٹ I think we have to use the modern technology to the best of our knowledge, best of our diagnosis, but at the same time maintain a human contact with the patient.
बिल्कुल सर थोड़ा सा आप अवेयर करें हमारे व्यूवर्स को जो फूड हैबिट्स हैं क्योंकि तब आपके जो टेन्योर है या आपके टाइम में एवरीथिंग वाज प्योर मैंने सुना है कि डल झीले डल इतना साफ था कि उसका पानी पिया भी जा सकता था लेकिन आज खाने में इतनी ज्यादा अडल्ट्रेशन है और सिडेंट्री लाइफस्टाइल जो लोगों ने स्विच किया है व्हाट्स योर टेक ऑन दैट हाउ शुड वी मेंटेन अ गुड एंड अ पॉजिटिव लाइफस्टाइल
This is very important because uh, technology has changed and we know much better about our food products now. We know much better about medicines now. We know much better about environment now. The question is with this pollution, which is occurring now in everywhere, there's a pollution in the water. We have put polythene in it. We are dumping everything in it. Now there was a time when one could use the dal water. People who used to go on a dal trip in a dunga used to use only dal water for drinking for everything. Now it cannot be done. Similarly, a pollution which is taking place now because of fumes, automobile fumes, burning wood fumes, other fumes, this has created environmental pollution. And there is unfortunately pollution in the food also. Now, the processed, highly processed foods which we are being provided now do look very charming, they look very tasty, but how they are processed, we do not know. For instance, if I tell you, if we are using uh, oil at that time, which was extracted from the brassica seeds, and it used to smell, and one had to boil it heat it for a long time to take away. Now, the oils which are available are without smell because they have been treated with chemicals to take away the smell, and that has added to the alteration of these food products. Highly processed foods are full of toxins, and there are additives added to it to color it, to change the taste, and we have lost that original thing, fresh vegetables from the garden, fresh fruits from the trees, and we are now being provided with preserved fruits, preserved vegetables. This has created a problem. Plus, our habits have changed. Unfortunately, previously people used to walk.
यस
Now, with all the automobiles, nobody walks. Previously, people used to communicate with each other. Now, we have become couch potatoes, watching TV and or a phone and doing nothing. Previously, we used to communicate, go and see relations, interchange ideas with each other, look after each other's problems. Now there's a phone that we nothing, nobody, no contact. This has changed. These modern technology has given us a lot of facilities, but there are downside to it also, and we have lost our moral, ethical, and religious values also.
सर थोड़े पॉइंट्स जानना चाहेंगे. हाउ वुड यू अवेयर पीपल टू स्टे अवे फ्रॉम अ sedentary lifestyle? How should we resolve an unhealthy way of being?
The sedentary lifestyle is killing lots of people. And if one has to go to a office or a working place or a shop and it is a couple of meters away, one should walk rather than use a automobile. And similarly, sitting at home is, even standing is enough. If you stand for some time, it is enough to help you. And you can take a, if in a bad weather, if there's no place to go, you can walk in your own room rather than be sitting for a long time. And similarly, we have to depend upon the fresh vegetables, fresh fruits, and consume less of uh, processed foods, less of fatty foods, and try to really go to our back uh, system. What Im Satana is wanate, haka bata gushung, that was the best. That was the best.
तवै छ वनान आजकल कशीर मंज के बुजुर्ग छ ज्यादा फिट जवानन हिंद खोत तिकाज तिमो छु पन्निस वक्तस मन सोरी के बड़ प्योर कंज्यूम कोरमुत आसान
Ach, titun pure consume be pakan. पेवान ओस गसुन मे ओस पेवान गसुन कॉलेज या स्कूल पकान पकान तिम ओस 2-3 किलोमीटर 4 किलोमीटर आसान आज छुन लड़कस आसान स्कूटी सु छ नेरान सुबह गोडनेथी पन्न इमन कोचिंग सेंटरन पेठन पत यिवान they have got a problem also. I think we have to change the system. Yus वनकनस cut throat competition. Uh, this has really affected the psyche of the students, and naturally, they are utilizing the modern technology. They want to use the internet rather than read the book. They want to go to college and schools on a scooty or a car. This has not to be we can't help it, but we have to change it. We have to do something about it, and people have to start going back to the walking habits, exercising. Schoolan maz drill karnavan. Mission khabar आजकल छा drill karnavan schoolan maz kin kihin tim बेos games आसान games छ वनकनस ति आसान मगर तूत छुन यूत तम सातन ओस आसान सड़क पे ति आसान बच्चे गिंदान सज पे फुटबॉल गिंदान वनकनस छुन ति कहीं I think we have to
get
re
back to those.
look into it. Yes.
Sir, we would like to know from you the patient and the doctor feedback system because you have practiced for a quite long time in abroad also other than Kashmir. So इंडिया में तो काफी जगहों पे पेशेंट फीडबैक बोर्ड्स हैं जहाँ पे अ पेशेंट कैन कम अप एंड ही कैन पुट हिज ग्रीवियंस बट कश्मीर में अभी तक ऐसा सिस्टम नहीं है. हाउ व्हाट्स योर टेक ऑन दैट?
What system?
The patient feedback system, whether he liked the doctor's
Patient,
treatment or not.
yeah, that is true. The feedback is to some extent there. When the patient comes for a second visit, doctor does tell him that your tests have shown this thing and you should do this, you should do that. Patient says, "Ben az gayi na farak ki, me az gayi farak, me os usko dawa." There's some, but the type of feedback which is for the patient in the Western is not there. Patients have certain rights, so have the doctors,
Okay.
and all of them have to use their rights and obligations also. And now, if you look at these recent events, doctors are being blamed. Now, you have to look into it that things can happen in the West also. Negligence has happened in the West also. But the violence which are taking place in Kashmir is not acceptable. We have to really evaluate whether the doctor is right. Sometimes recently, you must have read about it, and abdomen was open, not closed.
Yes,
This is a normal procedure in the West,
very true.
that when you open the what is called an exploratory laparotomy, you open and you find you cannot do anything,
And
or you
they
whatever
were
you will
quite
do,
unaware also.
what whatever will you'll do will be more harmful. So this is acceptable. But when in Kashmir it is said that
Yes,
is open and did not do nothing, which is not acceptable.
बिल्कुल,
We have to educate the patients.
yes.
We have to, there is a need, very, I mean,
Need of the hour.
highly need to educate the patient. This can be done on the electronic media. This can be done on the print media. This can be done by the group meetings. So educate the patients. What do you expect when you have a problem? What is the obligations of the doctor? What are his rights or her rights? And what are your rights? We have to educate the patients. And I'm sorry to say that we have to educate ourselves also, doctors. Unless and until we continuously educate ourselves, we will not be able to update ourselves to come to the expectations of the patients.
Very well said, sir. Sir, and lastly, I would like to know from you that आपका जो नाम है, जो आपकी शख्सियत है, it has left a legacy in Kashmir. So today, how satisfied does Dr. Allaqaband find himself, and where today do you find yourself in the field of medical science?
Wrong to say this. I am an ordinary human being, mortal human being. I have done whatever I could do. There are more intelligent people, more bright students now, bright doctors now than what we were. I try to do my best. I cannot boast to have been a really iconic figure, but what is now is that I am in a different environment now. I am away from my patients. My body is in US. My soul is in Kashmir, and my soul is with my patients. The greatest solace for me was when I used to sit in my clinic, much better than what I used to get at my home or even in the mosque. And that is gone now, but I am trying my best, whatever little I can
That
do,
must be the
to
best
put
part
on
of
the
Kashmir you must be missing.
well, trying to put a little bits on the internet, what I find useful might be useful for the patients, I do it. And it's also not for the patients, it's also for my keeping my upper story intact.
Important, very important. Sir, what message would you like to give to the young upcoming medical professionals?
Be honest, be truthful, and maintain a patient doctor patient relationship. Don't develop the mercenary spirit. And unfortunately, this private medical education has eroded into the system. Some student finds that his father or his guardians have spent 80 lakhs, 70 lakhs, 50 lakhs for his education. He has to get it back. How will he get it back? He has to work hard and sometimes use unfair means to get the money. This is bad. People who get on their own merit should be encouraged, and the honesty, and in medical curriculum we should have a subject like medical ethics now. It's very important to teach them what are the ethical values a doctor should have. Similarly, we should try to put patients' rights in writing in every outdoor in the hospital, every ward in the hospital, so that the patients, not only in English but in vernacular also, they know what are their rights, what are their obligations, so that this is known to them. And possibly we should try to put that in the schools and colleges also.
Very important. थैंक यू सो मच सर आई एम ऑनर्ड टू हेयर फ्रॉम यू आपका बहुत शुक्रिया
Thank you very much. The pleasure is mine. Pleasure is mine. Thank you very much. God bless you.